Hi, welcome to the Elevating Aesthetics podcast. I'm Brittany Perez.
And I'm Courtney Burke.
And today we have Corey Black with us from Zio. So excited. We love Zio and we love you too. So tell us a little bit about yourself and then we want to talk about the skincare line.
I have been with Zio for 8 years and it truly is a life-changing line. And I'm super passionate about it because of the results that I see and the text messages and all that. But I was in pharmaceuticals for years and I truly wanted to get into aesthetics and did that, and the rest is history.
Yes.
Love it.
So I have always come back to Zio because I work in the field. I've of course tried a lot of different things, and there's products that I like from other brands, but I always come back to my main routine of Zio. And so I totally agree with you. It does change the skin and it smells good. That's one of my favorite things about it.
Because I feel like a lot of skincare stinks.
Yeah.
And it doesn't feel luxurious while you're putting
Right.
it on. But all of the product, it just it smells so good.
Smells so good.
It smells so good.
We have a lot of essential oils in there too, so they don't linger, they dissipate.
Tell us a little bit about the history of Zio because it started with Obagi.
Mm-hmm.
And so how did that work out?
Zio has been around for about 18 years. Dr. Obagi sold Obagi and then started Zio Skin Health, which stands for his name, Zio Skin Health, Zane Obagi. And
Did not know that.
Yep,
What's his
Zio
first
is
name?
Zane
Zane Obagi.
Obagi.
Oh.
So that's why it's Zio, not Zoe.
Yeah.
So it's actually initials.
It's initials.
So that's how that started. He is fully still on working with, as our medical director, working with our chief scientist, Rick. And so they are constantly coming up with new products. Skincare evolves. So we need to maybe look at products that there's newer ingredients, different delivery systems. So they're always evolving. And that's the biggest thing. Zio, it's very tailorable. There's not a patient type that can't use it. And I love this line for that because it's very diverse.
Yeah, it's very user-friendly too.
Yep.
There are a lot of products, but just with your GSR,
Yes.
like getting the skin ready, it's such a nice, easy routine that you can start your patients on. Then they love it. And then you add in products that are specific to their concern.
Yes.
So it makes
That's the easiest part. When I train, I talk about, okay, we need the fundamental 4. We need to cleanse, we need to exfoliate, we need to tone, we need daily power defense. And then when you go from there, you build those protocols. So what is your number one concern? That's how we add 1 or 2 or 3 products. It doesn't have to be complicated. It really doesn't.
Yeah.
So if you could pick one of your favorite skincare products, whether it's an ingredient or one specific, you could do 2. What would it be and why?
Oh my gosh. It's one of the hardest things when people ask me the question on what my favorite product is. I would have to say, since vitamin A is the gold standard in anti-aging, wrinkle texture repair has always been my ride or die, and it will always be my ride or die. So if I have to be stranded on an island, I want wrinkle texture repair on board.
I love that.
Do you know that I've never tried that product?
Oh, love it. It's a dermal retinol. It's amazing.
So what's the percentage of retinol in that one?
0.5.
And what is the difference in that retinol versus other retinols?
I truly feel, with having used other lines and getting feedback from other, accounts, retinol from different lines are the same.
Right.
And technology is huge. Delivery systems are huge. We have 6 retinols, and wrinkle texture repair is a microemulsion delivery system. So it's going to go down to the dermis. So a lot of your retinols and your trets obviously are epidermis, but your wrinkle texture repair will go down to the dermis. You're going to get deeper pigment, deeper lines, texture. That's why I love it.
What is the downtime with that one?
When you're looking at, reactions, anticipated reactions, which is normal with retinols, it depends on how you go into it. The biggest thing is asking your clients, do you want to just kind of go full force and get that full skin restoration sooner rather than later? Then you just go into it every night. You can use hydrating cream to help with any type of reactions, or say it's someone that's I spend a lot of time out in the sun, so let's just try to start 2 nights a week and then go up from there.
Graduate. So tell us about using retinol in the morning, because we're all trained to use retinol and tretinoin at night. Is it deactivated by the sun? Can you use it during the day and at night? Give us a little.
You can use retinol during the day. I think that's pretty much kind of an outdated thought. The retinol skin brightener is one of our biggest ones that we use during the day. If you're not on a retinol at night, you can use it at night. But so when you're using, say you're using hydroquinone and you're titrating off of that, and we're titrating you off of that with retinol skin brightener because it is a brightening retinol, you're going to use that in the AM in place of your pigment control cream. It's safe.
What is added in the retinol that makes it brightening?
On our retinols, you'll see like the top of them will say anti-aging or they'll say brightening. And so you know that that's a brightening retinol.
That's so interesting. I need to learn more about the retinols within Zeo.
Yeah, we have 6.
Because I'm not super familiar. So we love innovation and staying current and staying with the times and working more towards like the regenerative type skin treatments and all that fun stuff. Tell us, if you had to choose just one product, what would it be?
Well, that's always a hard question, but I would have to go back to vitamin A being the gold standard for anti-aging, and wrinkle texture repair is my ride or die.
Love it.
How about you, Brett?
I would say Daily Power Defense for sure. I love it. It is my antioxidant, but it also acts as a moisturizer to some degree because it works on the hydration level of your skin as well. So my ride or die with Zeo is the Daily Power Defense for sure.
And what is Daily Power Defense?
Daily Power Defense is what we would say is a functional hydrator, meaning that everything with Zeo works at the cellular level, but Daily Power Defense is going to go in and it's going to communicate with those cells. Let's produce your own hydration. That's what you're here for. Sometimes we have sensitive skin, which is more of a compromised barrier or weakened barriers. Daily Power Defense is going to go in, tell those cells, let's produce your own hydration. So it's not sitting on top of the skin like a typical moisturizer. So that's one of the biggest things with Daily Power Defense. And then on top of that, it's the DNA repair and defense ingredients.
Healing your skin like on a deeper level. It's not something that just sits on the surface and makes you look glossy while you have it on. It's actually going in, driving in deeper and actually healing your tissues, which is so neat.
And telling your body to stimulate aging.
Yes, for sure.
And did you say what your favorite product was?
Mine has to be the exfoliating accelerator.
Yes, one of my favorites.
We accelerate that exfoliation.
It's so true. It's so true. It's a great product for everybody, actually.
And I do also love exfoliation because our skin cell turnover slows down as we get older. And whenever you have dead skin cells that are sitting on your skin, that's when you get the dullness, the age spots, the fine lines. And so really helping with that cellular turnover is so, so important.
And
very
speaking of cellular turnover, that also goes hand in hand with having a healthy skin barrier.
Yep. A compromised barrier or weakened barrier, you aren't tolerable to chemical peels, to lasers, to injectables. When you have healthy skin, you're going to have better outcomes with your injectables, better outcomes with your lasers. You're protecting your investment. When people come in here and they're doing their toxins or their fillers, if they're not using true medical grade skincare that's providing results, then you don't have the best canvas to work with.
I so agree. The first thing that I notice is the dullness in their skin or the pigmentation or fine lines on other parts of their face that can't be treated with tox. And it really is not a huge investment. I think a lot of people think that the skincare products are more expensive, but you can get a whole system for $140 like to get started, which is not very much.
And that's what I would say is for those particular people, when you talk to them, like, listen, you're spending this on your toxin fillers or your tox every 3 months. If you were to throw in just this daily kit for $140, you're going to see a difference within a matter of days. It's a big thing to have medical grade skincare in your practice, and then your practice because it is medical grade. It's not something that you get at Sephora or Ulta. You have the higher ingredients. That's an important key.
What you mean is like if you get a retinol, say from Sephora, and it says retinol, but it doesn't have a percentage, you're getting like the very last ingredient is retinol. But these products, you're getting the highest strength possible because it is a prescription strength. So you would need a whole bottle of the Sephora brand to get one pump of what you have.
For sure.
If you're maybe spending $30 at Sephora and spending $60 here, you're still getting way more value because you need way less product to get more of an effect. So really when it comes to medical grade versus over the counter, you're investing in something that's actually going to give you the results instead of spending money over and over again trying different products. Like we know these work. they're researched, they're proven. You don't need to try a bunch of products. We can give you a prescription for exactly what you need.
Yes. The thing about Zeo is that it sometimes can be overwhelming because we do have so many products, but I always say don't overcomplicate it. Start with the 4 core, which is cleansing, exfoliating, toning, and daily power defense. Top it with a sunscreen, but the 4 core is where we're going to start. And then when you find out what the number one concern is with that particular patient, then that's the products you go for. And then we start, that's the protocol. It's that simple. And then when, time goes on, maybe another concern needs to be addressed. And that's when you can finagle the protocol. But it's super easy with starting with your fundamental 4 and then adding products as you go.
So a little bit of tea time. Without spilling too much tea. Is there any new products in the making for this year?
We do have end of year meetings and they might say there's something coming. But typically the first of the year is when we know what product's coming. And then there's a launch very soon after.
But Zeo just released a new acne clarifying serum.
Oh,
Yes.
it's the bomb.
Yes.
Not even for acne, just pigment PIH.
Well, so complexion clarifying serum is a water-based 2% salicylic acid. So it's going to do just that. It's going to get after the oil and it's going to help with redness, inflammation, acne. It's going to do exactly that. Clarify, clear up the complexion.
I love that
and
thing.
it has been amazing since launch.
Yes. And I love the application. It's so
Great.
satisfying.
Is
It
it
is.
a full face treatment or is it a spot treatment?
Full face.
Full face treatment. Okay.
And like the pump gives you like this much. It's preloaded. So you can
Mhm.
really just put it in and it preloads itself.
Mm-hmm.
And then you just squirt it.
And it's a serum, so it's very light. So it's going to be, the thinnest to thickest rule. So it would be after your toning.
If you have someone kind of like me that's more normal to dry everywhere, but more hormonal, I guess you could use it like more as a spot treatment,
Mhm. Yes, you sure could.
just so that it doesn't over dry other areas.
Right. And then the complexion clarifying mask is a really good one too because it's your sulfur mask.
Okay.
And you can definitely spot treat with that and sleep in it overnight.
Okay, perfect.
Mm-hmm.
We were kind of talking a little bit before about programs for different people. And I kind of have like an idea in my head. And I know everyone has their own concerns, but we have like the Get Your Skin Ready, like the basic kit that I usually do for my like 20s to 30s. And my 30s to 45s are generally so interested in treating their pigment. And then like 45 to 65, we get into like more the anti-aging. So those are really nice kits that we have. But what would you say for someone that if it's summertime and they are wanting to treat their pigment, can they use their pigment products year round? Or do we need to take them off of certain products like hydroquinone and retinol and then put them back on?
So the great thing about anytime you're using brightening products, whether it's retinols or hydroquinone, first of all, we titrate off of hydroquinones. We pulse there, but we don't stay on it longer than 5 months. So we want them breaking. So it's very important to stay on top of those clients. But the biggest thing with any brightening, retinols or HQ, is finding out that person's, what is their lifestyle like? We live in Florida, we're in the sun all the time, but there's in the sun and then there's out in the sun on a boat. Sunbathing. And so if it's someone that's going to be out on the boat, sunbathing all the time, hydroquinone is probably not their best friend during the summertime. Can it be used during the summertime? Absolutely. Should retinols be stopped during the summertime? No. Yep. That is something that, we're trying to, anti-age, we're trying to lift pigment. So as long as people are using their sunscreen, wearing hats, reapplying, there's not a problem with using it.
And I love hearing you say that. There was some talk, even at some meetings, that was saying that you didn't want to use retinol during the day. Not that it wasn't effective, but that it's like deactivated by the sun. So I wasn't sure if, if that was a myth or a fact.
I think it was, I heard that years ago, but Dr. Abaji has, with the scientists, they've created all of these products and he's had over 45 years of experience. And
he knows what he's talking about.
I think, I call him the GOAT of skincare.
That's a fact.
I need to meet him.
Yes, you do.
There will be a time. That meeting.
There will be a time.
Sign me up right now.
There will be a time. That's honestly what makes this job so satisfying is that, I get messages, I get phone calls, have conversations, I get text messages about, things that, their face is so clear and their confidence is back. And that's the most rewarding part of this.
That's why I love aesthetics also, because I love immediate gratification products like filler, but also with skincare, you really change the way they feel about themselves and their confidence. I totally believe that, because that's what people see first. Like, yeah, everyone has like a few lines here and there, but when your skin looks beautiful, you look healthy. Healthy skin means you're healthy.
Yes.
And so that's what people gravitate towards. Like, you just look really good because you look healthy.
Zeo glow.
Yes.
It's true.
Because you are a sales representative, if we had someone, because we've talked all about how the skincare works, but if you had someone that wanted to do what you do because you love your job and it's so amazing, like, what is your path to get there?
I think sales is obviously, what you need experience in. They love aesthetic sales because you already have those relationships with derms, med spas, and plastic surgeons, and then a 4-year degree. Our trainers are estheticians, so we always, when we expand and we need trainers, we seek out estheticians.
That's awesome,
because they understand the skin.
And is that a full-time role, or do they work for your company and then they still are hands-on in their practice?
It's a full-time role. Because then once you take on a training position, you travel throughout the territories of those reps.
What do you see in practices that are most successful with Zeo? What are they doing different? Like, what are they doing to really help engage the patients, make them understand that they need to be on a skincare routine? What do you think sets them apart?
Truly using it full protocol. If you have other lines, fine. But if you want to get the optimal results and have people really have that wow factor, using Zeo in a protocol alone is best.
It is difficult. I do mix brands sometimes, but it is difficult to know what's working and what's not, because certain ingredients are meant to work together and they're studied to work together. Yeah. So Courtney is a big fan of Dr. Rajani, and he does like all the PRF. He works with Cosmo France, and he just posted a video on Instagram yesterday, and it really does make a lot of sense. He was saying how we should be really cautious as providers with what we're mixing together. Like, if we're mixing PRF with Radius, and that's never been studied, or we're mixing mixing filler with PRF. These things have never been studied, and we are meant to do evidence-based medicine. And so if we are mixing ingredients together from different companies that have never been studied and we're getting reactions, we don't know why. Right. So really, I do understand where you're coming from when you're saying to use protocols, because those ingredients were meant to be used together, and we want to do what's best for our patients and do it safely. And so I do agree with you.
If someone comes in with really complicated pigment, aging, anything that really needs something to come in, I always say Zeo is definitely that workhorse. You can totally go in and change your skin without going through all those reactions. But the more diseased skin you have, you probably will have to be on a more aggressive protocol. But then there are also products like hydrating cream that can get you through any of those reactions so that you're not stopping and you're getting through that to the other side of new skin.
And how long would a patient start to notice a result in their skin?
Majority of the time, either themselves or their family member or a friend within a week is like, what are you doing different? It's very quick. Yep. You exfoliate, get those dead skin cells off, get that dull skin off.
Yeah. Get the glow. Get the Zeo glow.
Get the Zeo glow.
My final question for you is, are you guys going to have a lip product?
So that's the $1 million question.
Next
because
year,
we used to have a lip product. And he actually created that lip product using a lot of Accutane. You get the cracked lips, right? The thing with that lip product was, not only was it the bomb, it was pricey, but comparing it to now, so many lip products have come out, it wasn't too pricey. Now it's become so popular that it went away because it wasn't a popular, people weren't willing to spend $50, but I will tell you, it would heal your skin overnight.
I know that after dermal filler, your lips are stretched and they get really dry and flaky.
Yes. And
perioral rhytids are the hardest things to treat, because you have a loss of volume, loss of collagen, a loss of elastin, and you don't want to put a lot of filler in there, because then you look like Marge Simpson. And something that could really build up that area without being too heavy and really stimulating the lip tissue. Yes, would be so nice. Please, let's add that.
Listen, we as a sales force have definitely said, let's have a lip product come back out.
You need one. Yes, that would finish the portfolio. I think it did.
For sure.
Perfect.
And maybe a body size growth factor serum.
Yes, I'll just take it back, borrow that.
Yeah,
home with
for
me.
sure.
Well, thank you so much for coming. This was super fun and educational. We
for sure.
always learn so much from Corey. I love the Zio products. I always come back to the Zio brand no matter what I try. All right, cheers.
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 Cheers to Zio and Corey.